Hi, I'm Dr. Keith Lonergan. I'm with Steadman Hawkins Clinic of the Carolinas. I put this video together today to talk to you about post-operative total shoulder care and expectations as well as rehab. Certainly, most folks have heard about knee and hip replacement. Sometimes the shoulder replacement is something that's new to people, and in particular, those that have undergone a severe fracture of the shoulder and would require replacement in order to provide the function that they would require for their activities of daily living. Shoulder replacements come in two general terms. One is done for arthritis, and one is done for rotator cuff, chronic rotator cuff problems that have developed into arthritis and or severe fractures of the shoulder. When you undergo a shoulder replacement, we are replacing the ball and socket joint with metal and plastic implants, and then requiring the soft tissue, which is the muscles and tendons around the shoulder, to heal around the new implant and provide you with the motion, stability, and the pain relief that you need. In the post-operative setting, after a total shoulder, we oftentimes will hospitalize the patient most of the time for a day, up to about 3 days, depending upon the severity of the injury or the complex nature of the problem. You'll spend a couple of days in the hospital. In general, you're out of bed the next day or even the day of surgery. We try to get you ambulating as early as possible to avoid any of the potential problems that can occur with prolonged immobilization, such as bed sores, pneumonia, and even blood clots in the lower extremities. In the first few days after shoulder replacement, when you're in the hospital, we really try to emphasize an immediate return to function of the remainder of the upper extremity. So from the elbow down, we start immediate motion of the elbow, wrist, and hand to avoid any kind of decompensation of your ability to perform simple tasks such as eating and personal hygiene. Regarding the shoulder, the post-op period is really set up in segments of 6 weeks. The first 6 weeks is a very gradual process where we're allowing certain muscles and tendons to heal around the new shoulder while doing some very simple maneuvers around the shoulder joint to provide a little bit of freedom of motion. We do some simple circle maneuvers and pendulum maneuvers called Codmans in order to provide some simple range of motion. After a period of about 6 weeks, you will most likely come out of the sling that you've been in on a permanent basis and start to fully engage the muscles around the shoulder as we have outlined in our post-op rehab program, both with the outpatient therapy as well as the home therapy that will be required to restore your motion and your strength. As is the case with any surgery, the first three days to first week are certainly the time where you have the most discomfort. We often use a cooling maneuver with a polar care device that will provide some cooling element to the shoulder. Certainly pain medication, such as narcotics or just simply the anti-inflammatory medicines such as Aleve and Motrin, and even Tylenol is extremely helpful in the post-operative period. Most folks start feeling extremely well after the first few weeks, certainly after you've had a replacement for arthritis, since the shoulder is now replaced and does not have bone rubbing against bone. Within the 3 or 4 months, we hope that we've reestablished the vast majority of your motion. Your strength is returning and your pain is certainly improving and hopefully minimal. When you continue to work on your strength over the next 4 to 6 months, we oftentimes tell you it can take up to a year to completely rehabilitate from a joint replacement. Things that we look for in the early postoperative period that we want to know right away is pain that is developing that has not been of the quality that you're used to, or you're developing any signs of an infection such as temperature, redness around the incision, or fluid around the shoulder itself. We want to know about those things right away so we can intervene if needed in order to provide you the best treatment. Shoulder replacement is a great surgery. It provides tremendous pain relief for our patients. We hope that this video will help you in the postoperative period and will help you enjoy your new shoulder for many years to come.